Hello, everybody. Hi, everybody on Instagram. Hi, everybody that's watching in the Facebook group. Happy Thursday. Welcome to this week's live training. Today, we're talking all about imposter syndrome. And this is likely something that just about everyone has felt at some point in your career. Most likely you felt it at the beginning. Maybe you felt it as a student when you were in PT school or OT school. Maybe you felt it as a brand new clinician, and you may have even felt this when you're starting a new job, even if you've been a PT or an OT for 10 years, right? So today I'm going to be talking all about imposter syndrome. We're going to talk about what it is, what you can do about it. So for those of you that don't know me, I am Dr. Jody Miller. I am a physical therapist and a mentor to PT students and new grads. I've worked in just about every setting that there is for PTs. I've worked in acute care, I've done oncology, I've done a lot of outpatient, I've done pediatrics, I've done home health. Most of my career has been skilled nursing. I was a rehab director at a skilled nursing facility, and now I own my own cash-based practice here in the Tampa area. And I'm also the owner of Clinical Connections Mentoring, which is where you are today. Welcome. Thank you for coming. What I'd like to do before we start is if you are watching live, please type live in the comments. Let me know, tell me who you are, where you're watching from. If you are watching the replay, same thing. Just type replay, tell me your name and where you're watching from. I'd just like to know who I'm talking to. So let's get started. So I want to start by defining what imposter syndrome is first. We got to define it before we can talk about it. So the definition of imposter syndrome is a feeling of self-doubt and incompetence along with the fear of being exposed as a fraud. So you doubt your skills, your knowledge, your abilities to do your job effectively. It comes with the fear, or somebody has the fear that they're not good enough to do their job, or you fear that you aren't as good as everybody around you, or that you don't belong. It's the belief that you don't deserve to be where you are. And it's the fear that those around you will discover that you don't know what you're doing, right? That you're a fraud. I see this come up a lot with students when they're in grad school. So I hear all the time, my grades are terrible. Everyone else is getting better grades than me. PT school is really, really hard for me. I'm just not cut out for this. Or I just don't get this material. It's not making sense. Maybe I shouldn't become a PT, right? Show of hands. If you've ever said that, you've ever thought it, whether you're a PT student now or while you were in PT school, go ahead and share. I know it is very common. You're not alone. I hear it all the time. Okay. So imposter syndrome is a sense of unworthiness that doesn't align with how others view you. So other people see your successes, patients tell you how much you've helped them, patients request to be seen only by you, but you believe that this is only happening by luck, not by your abilities or your knowledge. It's having trouble believing that you're worthy of success. And when you do succeed, you believe it's all because of luck, right? Like it has nothing to do with your knowledge or what you did. Your successes are purely happening because of luck. So the important thing to realize here is that imposter syndrome is twofold, right? It's the feeling of self-doubt, but also the belief that you're not worthy of success. And I think this is where some people can get confused because there's a difference between imposter syndrome and low confidence, right? A lot of people have low confidence, and that can happen anytime throughout your career. I've felt it a million times in my 15 years as a PT. But for someone to have true imposter syndrome, you have to have the feelings of self-doubt and the belief that you're not worthy of success. Okay, I'll give you an example. So feeling like you don't know enough to properly treat your patients is low confidence, right? But feeling like you don't know enough to properly treat your patients and also not recognizing that your patients are getting better, that your patients are asking to see you, that you're helping people with complex diagnoses, that is imposter syndrome. So see the difference there? So low confidence is just having low confidence. Imposter syndrome is that thinking that you don't know enough, but you also don't think you're worthy of success, right? So for someone to truly have imposter syndrome, you have to have those feelings of self-doubt and the belief that you're not worthy or deserving of success. Okay. So now let's talk about, where does it come from? So imposter syndrome starts with the belief that self-worth is contingent on achieving something. Okay. So it commonly occurs for someone who was raised in a family who put a lot of emphasis on achievements. That was me, right? Um, and this is okay if this was you. It's actually very common. It still happens now, right? So if your parents placed a lot of emphasis on doing well, getting good grades, getting first place in your sporting events, that is kind of where some imposter syndrome can start. But it also had to be that there was praise only when good things happened, right? So like, you got praise every time you got 100 on a test, or you got straight A's, or you got first place in your sporting event, right? But there was no praise when you got a B or you got third place, right? So imposter syndrome is kind of rooted when someone was raised in a family who put a lot of emphasis on achievement and then only celebrated those achievements. Okay. It can happen when most previous situations were easy for somebody. So somebody always got good grades in high school without having to do a lot of work, or they always easily passed their lab practicals. They always got A+ on their tests and quizzes and assignments. But then challenges start to present themselves. Like that person is no longer that A+ student. They start missing a few questions on exams. They have to study more because they don't understand the new material, or they start to struggle with those difficult or challenging patients who aren't those textbook cases, right? So when things were previously easy for someone and then they now have to start working a little bit harder, they start to tell themselves that they're not good enough. They're not good enough to be in a doctorate program. They're not good enough to become a PT or an OT. They're not good enough to work with a specific type of patient or a specific diagnosis or in a specific setting, right? So you can see how that things used to be easy for somebody, and then they start to experience some challenges, and then they start to feel like they're not good enough. Okay. Imposter syndrome also comes with comparison, and when you start to compare yourself to other people around you. So comparison is a really, really tricky thing that can lead to some pretty negative feelings about yourself, right? Remember, comparison is the thief of joy. That statement is absolutely true. There are very few good things that come when you compare yourself to others. So things like comparing yourself to other clinicians in the clinic or the facility that you work in, comparing yourself to other students in your class, comparing, like, what this happens all the time. You guys have an exam or you have a practical, and the first thing you do is, what did you get? What grade did you get? And when you start to compare your grade to other people's grades, bad things happen, right? It's really easy to compare yourself, but it is always inaccurate. Okay. Comparison leads to beliefs about yourself that are untrue. Remember, everybody has different experiences. They have different stories. They have different life events. They have different feelings, and they have different emotions than you. So their situations are different from yours. So there is no comparison to other people. Okay. I believe that imposter syndrome also comes from what we see in society and in social media, right? It's really easy to compare ourselves to people here. So people are constantly sharing their stories and their images of success on social media. And when we don't have those same stories or experiences, we start to believe that we're not good enough and that we're a fraud, right? It is very rare to see stories from other people of failure or bad days or bad experiences, right? That's like 10% of the time somebody shares something that they perceive to be a bad experience. So when all we see is everybody sharing their good things and their successes and all of their big wins, we start to think that because we're not having these same successes and wins, that we're not good enough, right? We think we should be just like them. And when we're not, we think we're not good enough, but that's not true. It's not accurate at all because you're only seeing their highlight reel. Okay. So what do you do about it? Okay, if you have imposter syndrome, what are you going to do about it, right? First, you have to figure out if it's simply just low confidence because you're starting something new or something different, or do you actually have imposter syndrome? So remember the definition of imposter syndrome that we started with. It's feelings of self-doubt and feeling like you're not worthy of success or you don't deserve success, successful things that happen to you, right? So first you got to recognize, is it just low confidence or is it truly imposter syndrome? Second, ask yourself, am I comparing myself to other people? Right? Do you catch yourself comparing yourself to your classmates, to your coworkers, to people on social media? If the answer is yes, try to dial back on that. Catch yourself, right? And say, am I comparing myself to somebody here or not, right? Remember, you're only seeing somebody's highlight reel. You're not the same person as the people that you work with, as people on social media. Everybody has a different experience, different circumstances, different feelings, different emotions, and all of these things create for different responses to different situations. So just because a coworker responds differently to a situation does not mean that they're better than you or that they know more than you. They just have different circumstances, different experiences to go off of, right? People on social media, your classmates, you're only seeing their best, right? Their positives. You don't see all the things, their negative experiences, their bad days, the things that are happening underneath the surface, their past. You don't see any of that. So these comparisons become inaccurate because you're only seeing the surface, not everything that's happening underneath or everything that led up to that situation. So instead, if you catch yourself comparing yourself to other people, try to compare yourself to your past self, right? Where were you before PT school? Where were you 3 years ago? Where were you 1 year ago? Where were you 6 months ago? So if you catch yourself comparing yourself to other people, your classmates, your coworkers, people on social media, stop, try to dial that back, and instead try to compare your current self to your past self. And are you better? Are you doing better or not? Okay. Third thing to do, if you actually do feel that you have imposter syndrome, is to ask yourself, what did I do great today? And what did I do great this week? They can be very small, they can be big. I encourage you to celebrate the small ones just as much as you celebrate those big things, but celebrate all of those wins, regardless of the size, whether they're small or they're big. Remember, small wins do add up to big wins, okay? Celebrate them every day, celebrate them every week, celebrate them every month, every year, however often you want to celebrate those wins, celebrate them regardless of the size, and really pay attention to those wins. And how does it feel when you celebrate those really good things that you did? Okay. Last, ask for help, get support, get guidance, right? You're in the right place for this. This is what I do in my complete clinician program. I guide high achieving clinicians who are feeling frustrated and exhausted in your career, gain that courage and gain that confidence so that you can get positive outcomes with your patients. You can continue to grow as a clinician how you want to, and you can build a career that supports that burnout-free work-life balance that'll allow you that freedom and to enjoy your nights and weekends, right? One of the big things that I help my clients on, new clinicians, work through is gaining confidence and overcoming imposter syndrome. I help them figure out, first of all, what they're experiencing. Then we work through strategies to move past these things, because whether it's low confidence or it's imposter syndrome, if you don't address it, you're going to continue to feel stressed out, overwhelmed, frustrated, and all of that over time is going to build up and become burnout. And nobody wants that, right? I dive much deeper into imposter syndrome and a ton of other things inside my program. I talk about confidence, burnout, clinical reasoning, effective communication skills, job selection, evaluations, exercise prescription, treatment planning, so much more inside my program. Because my job is to guide you and support you how you need it so that you can become that badass clinician that you want to be. Right? My program is specific to your needs. So if you're interested in getting some more support here, reach out, send me a message, drop complete in the comments if you're watching, and I'll give you the information that you need to apply and to chat more about my program. My doors are open right now for the next cohort that starts July 1st. So if you're feeling that pull, you want to learn a little bit more about what I talked about today about imposter syndrome, or maybe just a little bit more about that program, don't wait. Now's the time. So I hope you learned something new today. Go ahead and drop your comments or an aha moment, something that really stood out for you about what I talked about today about imposter syndrome. Share what you learned. Go ahead and drop it in the comments. I want to thank you for watching, whether you're on Instagram or you're watching in the Facebook group, whether you watched live or you came back and watched the replay. If you have any questions about what I talked about today, please feel free. Send me a DM, leave a question or your comment in the comments section. I will come back and answer you. I'd love to chat more because this is a kind of a tricky topic, imposter syndrome, but it affects a lot of people. A lot of people don't like to talk about the fact that they feel it. But if you don't, it only gets worse. So I'm here to chat with you about it. Like I said, send me a message, let's chat. Again, thank you for coming, and I will see you next time. See you.